Hello and welcome. Today, we're digging into the tricky world of chronic back pain. And we're going to look at a fascinating study that uncovered a huge disconnect between what the official medical guidelines say and what doctors are actually doing for their patients. Just think about it for a second. Let's say you go to two different, totally qualified specialists for the exact same problem. You'd probably expect them to suggest a pretty similar treatment plan, right? Well, as we're about to see, when it comes to one of the most common kinds of back pain, that's just not what happens at all. So, the specific condition we're talking about today has a bit of a mouthful of a name: lumbosacral radicular pain. You probably know it by its more common name, sciatica. Yep, it's that awful, radiating pain that shoots from your lower back down your leg. It is incredibly common, and for a lot of people, it turns into a chronic problem that can really take over your life. Now, for the 20 to 30% of folks where this pain just won't go away and becomes chronic, there are official clinical guidelines. You can think of them like a roadmap, something designed to give every doctor a clear, standardized, evidence-based way to treat it.
And that roadmap is actually pretty straightforward. It's really just a two-step plan. Step 1 is something called a prognostic nerve block. The easiest way to think of this is like a test drive. It's a little injection to see if you're actually a good candidate for the main treatment. If that test goes well, then you move on to step 2, pulsed radiofrequency, or PRF. And that's the actual therapy, the procedure meant to treat that irritated nerve. Seems simple, logical, and it's what's recommended.
But here's the million-dollar question. Is that official plan what doctors are really doing out there in their clinics? Are they following the roadmap? Well, a group of researchers in the Netherlands got curious and decided to find out for themselves.
And they were super direct about their mission. They sent out a detailed survey to accredited pain specialists all across the Netherlands. They basically wanted to hold up the official guidelines in one hand and the reality of what's happening in treatment rooms in the other and see how they matched up. And boy, were there some surprises. Right out of the gate, before they even got to the treatments, the researchers hit their first wall. They found this really fundamental disagreement. The doctors couldn't even agree on a single unified definition for the condition itself. I mean, just look at this chart. It tells the whole story. 40% of the specialists preferred the definition from one international group, the ISP. Another 34% used a definition from a Dutch federation, the FMS, and the remaining 27% used a third definition from the Dutch College of General Practitioners. We're talking about a three-way split on page 1, chapter 1. And the differences just kept getting more specific. When they asked about a really basic technical detail, literally, where's the best spot to insert the needle for the nerve block, there was still no consensus. As you can see, they were split pretty evenly between three completely different entry points. It just goes to show you that the physical act of doing the procedure changes depending on who you see. Okay, so all of this brings us right back to the main point. With all these disagreements on definitions and even basic techniques, what does that mean for that official two-step treatment plan? Are doctors actually doing that really important first step, the prognostic nerve block? Well, the answer turned out to be the study's biggest bombshell. Just look at this breakdown. A whopping 39% of specialists said they never perform the recommended nerve block. Another 34% only do it in very specific cases, which leaves, well, a pretty small minority who actually follow the guidelines as a rule. Let's just put that number up on the screen by itself, because this is really the heart of the whole story. 27%. Yep, just 27% of these specialists are routinely following the recommended first step. That means nearly 3 out of every 4 doctors in this study are, for one reason or another, deviating from the official guidelines. And the big question is, why? Now, it's really easy to jump to the conclusion that doctors are just ignoring the rules, right? But the reality is, as always, a lot more complicated than that. The researchers also dug into the reasons behind this major gap between the guidelines and the practice. And it turns out there's a whole host of practical, real-world reasons. You've got logistical hurdles and busy clinics. Some doctors just feel there isn't enough solid scientific proof that the first step actually makes the outcome any better. They also worry about putting patients through an extra procedure. And then, of course, there's money, costs and reimbursement issues, and frankly, just good old-fashioned skepticism from experienced doctors. So it really boils down to this core dilemma that doctors face. On the one hand, the case for the nerve block is that it helps you pick the right patients, so you don't do a bigger procedure on someone it won't help. But the case against it is that it's another hoop for the patient to jump through. It costs money, and its ability to actually predict success is still up for debate. And this is exactly why this whole study is so important. Even if you don't have back pain and don't live in the Netherlands, it shines a really bright light on this universal challenge in all of medicine, the massive gap that can exist between what the guidelines say on paper and what actually happens in a real busy clinic. And guess what? The variation doesn't even stop at the procedure. Doctors can't even fully agree on what success looks like after the treatment. As you can see here, most agree that things like reducing pain or needing less medication is a win, but way fewer, only about 42%, consider a patient getting back to work as a key measure of success. So the very goalposts for your treatment can shift depending on which doctor you see. So this whole situation leaves us with a really big, thought-provoking question. When it comes to your own healthcare, what do you want? Do you want a standardized roadmap that every single doctor follows to the letter, making sure care is consistent? Or is it better to have a custom tour, where an experienced doctor uses their own judgment and intuition to create a path just for you? There's no easy answer here, but it's a question that gets right to the very heart of what modern medicine is all about.